All right, good afternoon, everyone. My name is Alex Sorotsky. I'm a public health educator with the Washington Poison Center. We are so excited to be on our third day of the Washington Poison Center's Overdose Prevention, Harm Reduction, and Treatment series. I am thrilled to be joined today by our guest, Wynn. So Wynn is a pharmacy resident with the Kelly Ross Pharmacy Group. She graduated from the University of Washington School of Pharmacy in 2021, just this year, which I think means she gets extra clout because she finished school during a pandemic. That's really impressive. And Wynn is specifically interested in developing clinical services in the community pharmacy setting. So as we go through today, Wynn is going to educate everyone on how to recognize an opioid overdose, how to understand what naloxone is and how it works, how to respond to an opioid overdose and how to administer naloxone, and how to access a take-home naloxone kit in the state of Washington. So a bit of housekeeping before we dive in and I turn it over to Wynn. Please ask any questions you have in the comments section, whether it's on YouTube or Facebook. If all the tech is working right, we should be able to see those questions. We will answer those when we can. Worst case scenario, if we can't answer it during the stream, we will do some follow-up and answer in the comment section directly. Now keep an eye out. We're going to be posting a PDF to the slides that Wynn is going to use in the comment sections of both platforms. And without further ado, Wynn, take it away.
Thank you so much for the introduction, Alex. My name's Wen. I'm a pharmacy resident, work with Kelly Ross Pharmacy, and I'm so glad you're joining the live stream with us today. So let's just dive in. So first, let's look at some statistics from last year. Unfortunately, in 2020, we have seen more people in Washington die from drug overdose than any previous years. We're thinking COVID pandemic, unemployment, and social isolation both caused this significant increase in overdose deaths, which is really, really sad. Historically, there have been three waves of rise in opioid overdose. Beginning in 1999, most people who have opioid overdose death was by the prescription medication given by their doctor, either methadone or morphine. Just give you a couple examples. Starting in 2010, there have been rise in heroin use, and more people die from heroin overdose death. And started in 2013, synthetic opioid become the leading cause of overdose deaths, especially fentanyl. So fentanyl is a synthetic opioid that's very, very potent. It's colorless, it's odorless, and it's extremely strong. One dose of fentanyl is 50 times stronger than heroin and over 100 times stronger than morphine. And it's a prescription medication, however, it can be illicitly manufactured. And a lot of times it's laced into other street medication. So people who buy street medication from their dealer, they buy oxycodone or methadone, they're not aware there's actually fentanyl list in there, and they got exposure to fentanyl, which is a very strong and potent opioid, and they can get overdose from it. Just to show you how common drug overdose deaths are, starting in 2002, we have more people die from drug overdose in Washington than death from motor vehicle accident, which is very unfortunate. So what is overdose? An overdose is when someone takes something more than what their body can handle, and often at time that's a medication. And the amount of medication a person can handle varies between individual, and that amount can even change throughout the time for one person. Common drug class that cause overdose include opioid, stimulant, and benzodiazepine. And today we will mainly focus on opioid overdose. To give you a couple example, common seen opioids include morphine, heroin, methadone, oxycodone, and fentanyl, we just mentioned. So overdose can happen for anyone. So if a person get overdose, we should not assume they're a drug user or they abuse medication because it can really happen to anyone. People who have those following characteristics are more likely to experience overdose, and they should really be educated about the option of naloxone and carry a naloxone kit with them, just like people with a history of allergy should carry a EpiPen with them. Just provide extra layer of protection because they have those risk factors. If they have a previous history of overdose, buying street drugs, or use unprescribed substance, use larger amount of opioid, use the opioid with sedative, such as alcohol, benzodiazepine, antidepressant. They have comorbidity such as respiratory and psychiatric diseases. Those psychiatric diseases include depression, anxiety, bipolar, and schizophrenia. People are also more likely to have overdose when they are off opioid for a while. For example, one person used to take 5 tablets of oxycodone every day. He got sick. He stayed in hospital for a few weeks to get treated. Once he got out of the hospital, he can get overdose from the 5 tablets oxycodone per day because he become more sensitive to opioid, or he has lower tolerance because the period of break. So here are 5 essential steps for first responders who witness opioid overdose. The first is to check for the sign of opioid overdose. The second step, which can be most important thing, is call for help, dial 911, and administer naloxone. People administer naloxone shouldn't just walk away and call it good. They also want to support the person's breathing and monitor the person's response, which I will explain why in a couple slides. So the signs of overdose are usually on the quiet and subtle side. That's pretty different from what we've seen in movie or media of sign of overdose. So those could include slow, shallow breath, pale face or skin, limped arms, legs, purple fingernails or lips. Patient is vomiting, unable to speak or unconsciousness, and faint heartbeat. So if a person is not respond to shouting or verbal stimulant, a good way to try to wake them up is by sternal rub. So what you're gonna do is you're gonna use a closed fist and you're gonna use your knuckle to rub someone by their center of their chest. If it's wintertime when people wear multiple layer, you can also do the same thing to the upper of their lips. It's uncomfortable, but it's very effective and very safe. This is commonly used by emergency medicine services and paramedics in the field when they see someone passed out. So one of the most important steps will be call for help and dial 911. That's the bare minimum you need to do when you suspect someone have a opioid overdose. And the next step will be administer naloxone. What is naloxone? It's a strong opioid analgesic, which means it blocks the effect of opioid in the brain. Naloxone should be administered to anyone who shows sign of opioid overdose. So, naloxone has been approved by FDA and has been used decades by EMS to reverse opioid overdose. Naloxone comes in different forms. It can be injected intramuscular or it can be used intranasally. And what most people will see is on the bottom of the left is the Narcan. That's an intranasal administration, and it's the easiest one to use and the most commonly seen form of naloxone. So how do you administer Narcan or nasal naloxone? First, you take it out of the package. Then you hold the nozzle of the little spray, and you place and hold it into either of the nostril of the victim who have overdose. Left or right does not matter. And each kit come with one spray. You press the plunger and you administer the naloxone spray. It usually start working within 2 to 3 minutes. If the person is not working, you grab the other kit in the box and you administer the second dose. Again, which nozzle does not matter. Um, okay. So we mentioned the effect occurs within 2 to 3 minutes. The duration of effect of naloxone is about 30 to 90 minutes, and the people should be observed after this time frame because a lot of Norco or a lot of opioid works in our body for hours, which is longer than how long naloxone work, and people can easily go back to overdose. And oftentimes, more than one dose of naloxone are needed to revive someone who's overdosing. So it's very important that you keep the two little spray in one box. You do not want to separate a box because you're likely to need more than one. If someone wants to have a kit with them in the home, one with their one at work, they just need to request multiple boxes. They do not want to separate those two spray apart. Naloxone is very, very safe. Even you give naloxone spray to someone who do not have opioid overdose, they will be fine. There's no side effect. So someone witness or suspect opioid overdose, they might feel hesitant to call 911 or administer naloxone because they are afraid getting in trouble because there's drug involved at the field. However, in June 2010, Washington enacted the Good Samaritan Law, and it provides protection for people who call 911 and administer naloxone. Nobody gonna go after the person and start prosecute for they having medication and they owning drugs and giving naloxone. So call 911 and giving a naloxone is a very kind behavior, and that's the bare minimum we want to do. So the step 4, support the person's breathing, is optional steps. If you know the person, if there is a mouth guard available, that's something extra. You can help give oxygen to their brain, to their heart, to save their brain cells when they're no breathing. So what you're gonna do is you're gonna place one hand on the person's chin, tilt their head back, and pinch the nose close. Then you will place your mouth over the person's mouth to make a seal and give 2 slow breaths. And you should see the victim's chest rise, but not the stomach. And you follow up with 1 breath every 5 seconds. If you don't have a mouth guard on hand or you don't feel comfortable, you do not need to do this step. But the step 5 is very important. You want to stay with a person who wake from opioid overdose because they won't be the happiest person in the world when they wake up from opioid withdrawal. They might feel very uncomfortable. They might have a nauseous, vomiting. They have a fast heart rate, and they might become agitated or angry or competitive. So you want to stay with them, try to comfort them, help them remain calm and warm. So since the persons who have opioid overdose get treated in hospital is crucial because we mentioned early naloxone only works in our body for 30 to 90 minutes and opioid can work in our body for hours. So they can go back to another overdose. So we definitely want to send people to the hospital. Here are some do and don'ts in responding to opioid overdose. We do want to support the person's breathing and by administer oxygen or performing rescue breathing if you feel comfortable. We do want to administer naloxone. We do want to put a person in rescue position on their side if he or she is breathing independently. We do want to stay with the person and keep him or her warm. We do not want to slap or try forcefully stimulate a person. It can only cause further injury. And remember, sternal rub is a safe practice that you can use to try to wake someone. We do not want to put that person into a cold bath or shower that increase the risk for falling, drowning, and put them into shock by changing their body temperature. We should not inject a person with any substance such as salt water, milk, speed, heroin. The only safe and appropriate treatment is naloxone. We should not try to awake them by make them vomit the drugs that they might have swollen. Choking or inhaling vomit into their lung can cause fatal injury. A good news is the naloxone distribution has been increased. In 2014, there have been over 150,000 of potential overdose bystanders received overdose education and naloxone, and close to 30K of overdose reversal were reported afterwards. That means 30,000 lives could be saved by naloxone. Might be saved by naloxone. Another good news is in Washington State, you do not need to get a prescription from the healthcare provider to receive naloxone. The pharmacy will use the statewide standing order to dispense naloxone as the prescription. The stopoverdose.org has excellent map you can use to find the closest naloxone available to you. You can get naloxone either in pharmacy and in community programs such as a syringe exchange or other community program that they distribute naloxone. We recommend you always contact the pharmacy or program first to check in their availability, cost, and form of naloxone. But again, most of time they will provide you intranasal Narcan naloxone. The insurance coverage of naloxone has been getting better, especially state insurance. There's no copay for naloxone, and state insurance, Medicaid, does not set a limit on the number of kits can be obtained in 1 year. Who should carry a naloxone? The answer is anyone can get naloxone, and anyone should get naloxone, especially who might experience or witness an overdose event. And for example, if you take bus on 3rd Avenue every day and you see uh, you think you might witness an overdose event, it's a great idea you carry a naloxone with you. And we want to normalize carrying a naloxone just like a patient carry an EpiPen if they have a allergy. It's a very safe and effective kit that will save life. Some other resources, stopoverdose.org is excellent website that it teaches Washington resident how to respond, how to prevent an opioid overdose. And there's the great map. You can see, you can find the closest naloxone near you. Another resource that we have available in King County is called Least and Lethal. In this website, people can learn more about what fentanyl is, how to use naloxone, and how to get naloxone for free. Kelly Ross Pharmacy is the supplier for naloxone for this website, for this program. You can fill out your information and our pharmacy will ship naloxone to you for free. We do not need to go through insurance information. The only requirement is you need to be a King County resident, and we hope to see similar program available in other county as well. And our pharmacy group also have a great training video teach you how to use naloxone. We have provider toolkits, patient toolkits, and you can find our contact information on there. And that concludes my presentation for today. If you have any question, feel free to give us a call or send our pharmacist questions. We're happy to help you. And everyone keep calm and carry naloxone. I need a script in my name. How do I help them to become more informed? So that's a great question. Thank you, Nicole. So in Washington, there is a statewide standing order to dispense naloxone. Pharmacy and can use this as a prescription, and you can open the link that Katie just shared in the link, and that act like a prescription. And you can teach that pharmacist. Oh man, any resource for Eastern Washington? You can still use the same standing order in Eastern Washington as well as a statewide order. And so it looks like there are some sites also available in Eastern Washington at the stopoverdose.org. Maybe you can search by the county, or you can put in your zip code.
All right, Wynn, thank you so much. That was just excellent information. And again, please ask any questions, folks who are watching now, in those comment sections. And worst case, if you think of a question after we're done today, go ahead and add it anyway. We'll follow up and do our best to get you the best information we can. While we're waiting for any additional questions to come through, I have a few questions for you, Wynn, that we're trying to ask all of our panelists. All right, so the first one is, what is one thing you wish everyone knew about overdose?
Overdose can happen to anyone, whether you are on low dose of opioid or you are on high dose opioid, whether you have history or not. We shouldn't think of people who are just taking low dose oxycodone after their dental surgery, they won't get overdose. It can happen to anyone. And we should all know about naloxone and have a kit at in our house. Since it's free, it's available. It does not need prescription.
Excellent information. And I'm still just, I've known about naloxone for years, and I'm still like mind blown that right now, I could administer naloxone to myself and be just fine. Nothing would happen. I think that is just excellent.
Yes, waking up from overdose withdrawal is uncomfortable, but naloxone is extremely safe. You're not gonna cause any harm by giving someone naloxone.
Now, I got a quick question that's coming through from a different chat source. So at the Poison Center, we get a lot of calls about kids getting into all sorts of substances. Is there any concern with a child administering naloxone to themselves? Would they hurt themselves if they administered to themselves and got into naloxone?
And that's an excellent question. Katie, I don't think there is an issue for kids to administer naloxone, but we can definitely double check and get back to you. Great question.
Oh, and here's Katie.
I'm going to go ahead and just jump in. My name is Katie. I'm a pharmacist with Kelly Ross as well. I work really closely with Wen. In terms of kids administering naloxone, that's okay. In my opinion, it should be kind of like teaching your kids how to use a fire extinguisher. It's very, very simple. Like Wen said, you just peel it back, insert it in someone's nose and push. And if someone doesn't have opioids in their system, it's not going to cause any harm. In fact, there's no age limit on who can obtain naloxone in Washington State. If they have the wherewithal to bring a prescription in or ask for it, they can be given naloxone.
Fantastic. Thank you for jumping in and sharing that, Katie. I appreciate that.
Thank you, Katie. An excellent question, Alex. That's a very important question, like whether kids can give naloxone, and it's perfectly safe.
Wonderful. That's great to know. All right, and I think I know what your answer to this will be, but our next question will be, what is one action step you want folks to take after watching this training today?
One action I like to ask everyone to do is get a naloxone kit next time when they come to the pharmacy. And if the pharmacist is not aware and say, oh, they need a prescription, they can show the statewide dispensing order for naloxone. So they can teach their pharmacist about this crucial information. Excellent.
All right, my final question to you, then I think we'll go ahead and wrap up the stream shortly after. There's a lot of emotional weight, a lot of heft to this kind of work, working with overdose. So what is one thing that gives you hope in this kind of work?
One hope I have is I feel patients who take opioid prescription, they feel more comfortable receiving the offer of naloxone. We like to offer patients who we think have a higher risk, and they're usually happy to listen to what naloxone is and get the prescription, get the naloxone kit from us, and it doesn't give them any cost. Their insurance usually cover it for free, and for lethal program, we got many requests every day, and we shipped out many naloxone kit free of charge to them. So it makes me very happy to think more people have naloxone at their home, just like part of their first aid kit.
Absolutely, excellent. And I apparently lied because I'm seeing yet another question pop through. So this theoretically is the final question for you. Mm-hmm. So can you explain just a little bit why fentanyl can be added to substances and drugs on the street?
Katie, correct me if I'm wrong. I think the reason why fentanyl can be added to street drugs is very, very potent.
It's a combination of that, and it's really cheap. So sometimes it's cut with it and added in to make their drugs more potent and not at an added cost. And that's where the danger really lies, is because, as Wen said, fentanyl is incredibly potent. You cannot tell it's in anything. It's odorless, colorless. It fits right in with everything else. And it's not regulated often when drugs are bought off the street. So you could get a package of 10 pills or something, and one of them could have lethal doses of fentanyl in it. So just because you tolerated something before from that specific dealer doesn't mean you will in the future as well.
Is there any danger to touching someone or helping someone who's overdosing with fentanyl? No, there's no danger. You won't get exposed medication just by helping them or administer naloxone. It's perfectly safe for the people who help.
Excellent, thank you. And I'm actually, these questions are generating more. So I got another one. There we go. It's pulled up right there. Does drinking alcohol, taking Xanax, or other drugs support the overdose?
Unfortunately, it does not. We do not want to drink alcohol or taking other substance. It can make the overdose worse, and it deprives oxygen from the brain in your body, and it's not a good thing to do. Naloxone is the only safe and effective way to revive someone from overdose.
All right. I think now is probably a good time to wrap up. We're just about at the half an hour mark. And let's see, making sure there's no other pressing questions. I think we're good to go. So once again, a massive thank you to both Wynn and Katie. Oh, no, wait, every time I think we're done, there's something else that pops up. Katie, go right ahead.
Yeah, I see a couple comments about fentanyl being deadly, and that is absolutely correct. The main thing is if there's any drug substances, particularly like fentanyl patches, if you were to touch those with your skin, absolutely that's a way to get the medicine in your body as well. But as long as you're not touching any drugs yourself, you should have no danger in that regard, as long as you're just touching the Narcan and inserting into the nasal pathway. So definitely do what you feel is right. If you have gloves, certainly you can glove up, but the touching of the Narcan and inserting into the nose should not pose that specific danger. So just make sure you're not touching any substances.
All right, perfect.
Great answer.
Anything else you? Oh, perfect. Thank you. Go ahead. All right. Unless there are last thoughts from either of you, Wen or Katie, I think we'll go ahead and wrap up the stream.
Thank you for having us.
Thank you.
Wonderful. Thank you so much for being here. Stay safe, everyone, and get Narcan or Naloxone whenever you can. Take care.